it is time for our state to reopen. And speaking of reopening and how we do it safely and responsibly, really pleased to be joined by somebody from the Heritage Foundation, Mr. Robert Bluey. And the Heritage Foundation has devised a COVID tracker to assist state and local leaders to do exactly that, to safely and deliberately reopen. Robert Bluey is a journalist by trade. He's the vice president of communications at the Heritage Foundation, and he's a founding editor of the Daily Signal. Robert, welcome to the show.
Hey, it's great to be with you. Thank you for having me.
You bet. So, can you please fill us in on the details? And Heritage Foundation, by the way, folks, most of my listeners know very well who Heritage is, but it's literally the gold standard, I believe, of think tanks, and particularly on the conservative side. They for decades have been putting out incredible publications and information and speakers, and they were really instrumental in the Reagan Revolution. So going all the way back to the 80s, but to this day, are really thought leaders on so many subjects. And so, Rob, can you tell us about what Heritage is doing specifically regarding this COVID tracker to assist localities in opening up?
Well, thank you for that. And the National Coronavirus Recovery Commission, which Heritage convened, it's 17 different experts led by our president, Kay James, who is also a member of President Trump's task force. We decided to put together this commission to give state and local leaders, as well as federal officials, guidance on how to reopen. And so we start with states and localities because that's where we believe the best decisions will be made. After all, they're closest to the people, and we don't often want, as conservatives, Washington dictating how things are done.
Sure.
Now, the problem is that every state and local leader has a different set of standards. So what we wanted to do was build a map where they could see county by county how they were performing. And in fact, looking at the data from today, Cook County, Illinois is actually, down 38% from cases in terms of the direction it's headed. The trend in new cases is declining. Mm-hmm. And so we want to give local leaders this information. So when you talk about the governor and local leaders, they are obviously having a tremendous impact on the livelihoods of Americans here. Let's make sure they're making the right decision.
Right, and armed with the right information. I'm so glad you mentioned that about Chicago and Cook County, because this is not statistical, it's just anecdotal. But when I talk to doctors, and I take this very seriously, though, and I've talked to so many doctors since the beginning of this crisis. Unfortunately, very few of them are willing to come on air, which I do understand. And in a lot of cases, their hospitals just won't let them, or their practice groups are just not allowed to come on air. But what they tell me overwhelmingly in Chicago, right, which is supposedly in the state of Illinois, the place that things are severe, is they tell me that literally the ERs are empty and the hospitals are nearly empty. As a matter of fact, not only did we not crash the healthcare system in this country, everywhere basically except for the New York area, everywhere else in the country, the very opposite is true. We are starving the healthcare system of this country, which is both detrimental to a lot of people's health who do need to be getting into hospitals and doctors for various reasons. But on top of that is a huge financial risk. I mean, it's really the paradox here, I believe, Rob, and I'd like to get your view. The paradox is that in the name of protecting the healthcare system, we're actually endangering the healthcare system's financial soundness.
I'm so glad you brought that up. And it's not just the financial soundness of the healthcare system, but it's also the health and welfare of the American people. If they can't get their normal teeth cleanings at the dentist, and if they can't, get to the doctor for those preventative care visits, the annual physicals, think about how many times somebody visits a doctor and they find something just because they took the preventative steps. And by shutting them down, they're not allowing Americans to do that. So we've started to see governors reopen those facilities. After all, who's better to protect your health than a doctor's office? I think we should be able to trust our doctors and dentists with that. So you're absolutely correct in that respect. And there are people suffering, ill health effects as a result of them being closed. We need to get them back open first and foremost. That's a top priority of this commission.
Right. And, also, to that point, we've heard a lot about, so-called elective, and I'm saying that really with quotes, elective procedures. Well, I've talked to a lot of folks who need procedures done that don't sound very elective to me. I mean, these are things that they need to have done, at least to live a normal life. I mean, yeah, maybe it's elective if you're willing to just sit on the couch, right? But if you want to do things that you want to do as a human being, as a citizen of the United States, a lot of these procedures are not elective at all. And to your point, too, it's amazing to me that a lot of these governors and a lot of public health officials are unwilling to trust doctors, as if they're not capable, the doctors and nurses and healthcare professionals, of doing surgeries and avoiding risk themselves. I mean, that's what they do for a living, right, is operate on very sick people, sometimes people who have contagious situations that the doctors are trying to address. And they, if anyone, know how to do that safely. Let's trust them to do those jobs.
You're absolutely correct, and I could see initially in mid-March when everything was really
I
popping,
agree.
and
Sure.
there was a concern, right, that we didn't have the personal protective equipment and everything that the doctors would need. I think we are now in a situation where we're in a much better situation with masks. The American people, let's face it, have made their own masks, whether they're cloth masks or they found masks at the store. So we don't have the same kind of situation that we did 2 months ago.
Right.
And I think that's one of the factors. Just today, for instance, Washington, D.C.'s mayor extended the stay-at-home order until June 8th.
I saw that.
Similar to what Virginia's governor is doing. So some of these big city mayors are making decisions that, I think have left a lot of people scratching their heads. Do you not have trust and confidence in the American people? And let's face it, Steve, one of the other factors here is the longer this goes on, I think that, the American people will reach a point where not only will they become frustrated, but they're also going to lose confidence themselves. And so we need our elected leaders to be
Rob, I don't mean to interrupt you, but
education.
we've got to take a quick break. I want to talk more about that, too, about that issue of trust between leadership and the citizenry. We're going to continue the conversation with Rob Bluey of Heritage Foundation up next. Talking about the lockdowns right now and the necessity of getting the very best data to local leaders. Really pleased to be joined by Rob Bluey of the Heritage Foundation. Heritage Foundation does a lot of amazing things for our country, and one of the most recent programs of Heritage is a COVID-19 tracker to assist state and local leaders. It goes all the way down to the county level to give them the data that is most pertinent and up to date for them. So, and Rob is the Vice President of Communications at Heritage Foundation. Rob, I want to ask you about this idea that we were mentioning before the break of really the social compact, that the people agree at times to surrender rights to government, but for a purpose. And so in this case, there was, in my view, a very clear bargain that was made between the people and between government. Government told us that we had to shut down our society in really drastic and draconian ways, and to do so with the understanding that we could not overwhelm the healthcare system. We didn't want something to happen here like happened in northern Italy, for example. And although the measures were harsh and it was very onerous, I think the overwhelming majority of Americans, and polling shows this, agreed to it. Said, okay, as a country, we're facing something scary, in some ways unprecedented here. So we're going to agree. We're going to essentially forfeit our rights as citizens temporarily, with the understanding being that once we hit this goal, we're going to reasonably reopen. Well, instead, those goalposts keep getting moved because, as we were talking about, Rob, not only do we not overwhelm the healthcare system, if anything, the problem is the opposite. The healthcare system is underwhelmed at this point right now. And so I really worry bigger picture, even once we're past this current virus crisis, I worry bigger picture about the damage that does, breaking that bargain essentially with the people to the social compact of our country.
I think you're right, Steve. And let's face it, the media does play a big role in terms of the American people's perception about our leaders. I think it's one reason why you see such high approval ratings for somebody like an Andrew Cuomo, and then President Trump, maybe had early success in terms of capturing some people, but lately, the attacks on him by the news media have definitely depressed some of his numbers as well. So it's quite a contrast, and I think that the leaders in our country do need to send a clear message, but at the same time, as you said, moving the goalposts. We have a situation right outside of Washington, D.C. in Northern Virginia, where the governor of Virginia has decided to open up the rest of the state, but he said that the counties around Washington, D.C. can't. So I think it sends one of those messages to the American people where there's confusion, there's uncertainty, and that is certainly not the message that you want to send to them, particularly when so many people are suffering with the consequences of these shutdowns.
Sure.
And that includes losing their jobs and having impacts on their families. And so I think that's why it's important to have clarity. That's one of the reasons that we've said with our National Coronavirus Recovery Commission, leadership is critical in this situation.
Right. To that point that you mentioned about the power of the press, and you mentioned Governor Cuomo, which it's amazing to me because I think if you actually look at the facts of how he has managed New York, he's the worst performing leader in America by far, particularly as it relates to nursing homes. I mean, there's just an absolute debacle that the fact that he forced infected patients back into nursing homes to be to mix amongst the most vulnerable people in society. 5,000 total deaths in New York nursing homes. Many of them, by the way, and this doesn't get enough attention, many of them state-run homes for veterans, our bravest veterans who were killed because of terrible decision-making by Governor Cuomo and his team. And yet, though, Rob, and I know your background is in journalism, and yet because of the power of the press and because he's a pretty skilled communicator and the press has been fawning over him, his approval ratings are fantastic right now. And if you contrast that, for example, with Governor DeSantis in Florida, who seems to me to be the model governor right now, particularly as it relates to old folks in a state that is full of elderly, vulnerable people. He was so intentional about protecting nursing homes that he's the diametric opposite of Governor Cuomo. And yet, Ron DeSantis' numbers, actually, I mean, he's still quite popular, but his approval numbers, if anything, have actually been ticking slightly downward while Cuomo skyrocket higher. Your thoughts?
I'm glad you brought up that comparison because I think it's one that we should certainly take a look at. And you're absolutely correct in that respect. New York and Florida definitely have similarities in respect to the type of people who live there. They're both populous states. They both have large cities. But one of the things, and this is from a guy who grew up in upstate New York and whose parents still live there, I can tell you that New York State is quite a diverse state.
Of
and
course.
what is maybe appropriate for the city of New York is not for the rest of the state. And so the same draconian rules that Cuomo has imposed on the city are applicable to upstate. And I know that many of those counties are not facing the type of situation. So, see, this is why we say it's really important to localize these decisions as much as possible, why we did the county-by-county map, because we want to make sure that those local leaders have the information at their fingertips. And when it comes to the media's coverage of this, yeah, I think you're absolutely correct. Governor DeSantis has received much harsher treatment in the press. Meanwhile, Governor Cuomo is going on CNN with his brother on a regular basis
Right.
and getting softball questions.
Well,
so
we could do a whole hour just talking about the Cuomo brothers. But listen, I'm Rob Bluey of the Heritage Foundation. I sure appreciate you being my guest today. Thank you.
Thank you, Steve.
You bet. So, folks, I think, these points are so important about the power of media. And again, that's one of the main reasons that I'm very intent and take very seriously the role of trying to be a media watchdog for you. Because, just consider that example of Governor Cuomo's treatment, even though he's been the least responsible governor in America, versus the way the press treats Governor DeSantis, who I think has been a model of leadership, particularly as it relates to protecting nursing homes, to protecting the elderly in this country. The press is powerful, but we will also always hold them to account here on the Steve Cortes Show. It's one of the main reasons I take it as a foundational purpose for this show. Up next, we're going to talk with Matt Tiermond about financial markets, about your money and investing. Coming up.